as the chairs are being brought to the stage, I'll just introduce this second panel, which we're calling Promoting Health and Saving Lives, Supporting Public Health on the Front Lines. And you're going to hear some of the themes that have been brought out by both Secretary Sebelius and Secretary Leavitt into this panel. And I'll briefly state that this panel is going to speak to, from their perspectives, as public health, healthcare, and policy experts, the pressing issues that policymakers really should be considering in this next administration and Congress. So I'll have our panelists join me on the stage, Dr. Frederick Cerise, Dr. Susan Kansagra, and Dr. Anand Parekh, who will join me on the stage. And I will introduce them going from my left. Dr. Cerise is the president and CEO of Parkland Health, which is one of the largest academic and public safety net hospital systems in the country, serving the comprehensive healthcare needs of a largely uninsured population. Dr. Cerise previously served as the Secretary of Louisiana's Department of Health and Hospitals. Next to him is Dr. Susan Kansagra, who is a public health leader, most recently served as the State Health Officer for North Carolina and the Assistant Secretary for Public Health of the North Carolina Department of Health and Human Services. She also has local experience, having served as the Deputy Commissioner of the New York City Health Department. And then our third speaker is Dr. Anand Parekh. Dr. Parekh is the Chief Medical Advisor at the Bipartisan Policy Center, which is commonly known as BPC. Every time I say the word bipartisan, I see head nods and appreciation. So where he provides clinical and public health expertise across the organization on a variety of public health, of policy issues, including the future of public health. And prior to joining BPC, he served as the Deputy Assistant Secretary for Health at HHS. So as you can see, we have an amazing group here with experience and expertise at the federal, state, and local levels, private and public sector experience and expertise. So please join me in welcoming our second panel. So I'm going to start our conversation. Certainly I know something that is top of mind is around what we're seeing in terms of the great human toll from Hurricane Helene. And the concern that is arising around yet another hurricane that is coming toward our shores. And as you heard the Secretary speak about this, it's not only the physical health risks, but it's also the trauma that communities are facing, either in terms of lives lost, some families still searching for loved ones, the trauma of losing your home, seeing your neighbors suffering, all of these issues. And we think then too about the public health, the healthcare, and the policy implications around such significant disasters and emergencies that happen, such as Hurricane Helene. Susan, I want to start with you and first say that our thoughts are with you and the residents of North Carolina as they are continuing to deal with the aftermath of Hurricane Helene. You know, we heard the Secretary speak about what emergency response and preparedness looks like. Can you tell us from your vantage point, having just served as the state health officer for that state, how does a state health officer prepare, respond to what's becoming now really a growing number of these types of emergencies?
Yeah. Well, first, let me just thank you for keeping Western North Carolina in your thoughts and in everybody's thoughts. It really is just devastating to see and heart-wrenching to see what is happening. Families picking up the pieces literally and figuratively, really heart-wrenching. But equally as powerful and uplifting has been all of the support that folks across North Carolina and across the country have been giving, and really appreciate that support. So thanks to those first responders that are still on the ground right now, both federal, state, local officials that are there. Appreciate everyone keeping our communities in their thoughts. To your question, you know, I think this is a really important one because I could talk about the dozens of ways that public health right now is supporting operations on the ground response, whether that's shelter operations, preventing communicable disease, whether that's supporting food sanitation, water quality, making sure our first responders have tetanus vaccine. We could talk about all those things that are happening now, but to me, a critical job of public health is what happened in 364 days before that event happened. Because, you know, we call that readiness, we call that preparedness, but really that is response too. And that is response where you might not know what you're responding to yet, but everything you are doing leading up to an event is something that will come to bear and bring to bear on then the things that happen afterwards. And I think most important there is thinking about what are the systems, the processes, and most importantly, the relationships that you are putting in place. The role of public health is oftentimes that convener, and how we think about that in communities. In North Carolina, we're fortunate. We have dozens of local health departments that support each of our counties, and we have the state health department as well. How we work together along with our federal partners, and how we build those relationships, and how we build relationships on the ground, whether that's with your dialysis centers, your healthcare organizations, your long-term care facilities, your CBOs that might have access to populations that you can't always get to. I think building those relationships and being ready, regardless of what that emergency will be, is really critical. I also think, the systems that we put in place to keep people healthy, they are important before an emergency, and they are especially important after an emergency. And we are fortunate in North Carolina that we passed Medicaid expansion. We have 550,000 people that now have access to health insurance that otherwise wouldn't have, and many of those people are in Western North Carolina. So the fact that we are able to provide that, behavioral health resources, which you talked about, really fortunate our legislature put forward $800 million investment in behavioral health resources, which were needed before, but especially needed afterwards. So I think all that work that happens before an emergency is critical as a state health officer, not just what you're doing after a response, which is equally as critical, but both certainly have their role and are equally important in making sure that we are responding in the best way for our communities.
Thanks, Susan. Fred, from your vantage point, you're sitting there, you're leading a healthcare system. How then do you think about the preparation, the response to these types of emergencies?
Well, I've seen the response from health system. I've seen bad responses, and I've seen really positive responses. And so it really varies by system. Unfortunately, there's not a great set of standards that says you shall do this when something terribly unexpected happens that we should all be planning for. So after Katrina, I was in the back of a military vehicle with patients on ventilators on the top of a parking garage of a hospital where there was a man with a gun controlling helicopters, and the patients couldn't get on because other healthy people were running on and off. That is the worst. And it speaks to not having those relationships and plans ahead of time. And I've also seen the best where, in the setting of an Ebola threat in Dallas, hospitals working together to identify a separate facility that would house a potential number of patients that didn't materialize. And I saw hospitals working together during COVID to share data, to share plans, to share resources, to level load, so that as a community we work together to be able to optimize resources to take care of patients. So there are standards. They're not the highest standards in terms of being able to operationalize plans. Joint Commission says you've got to have a plan, but it's a paper plan on what will you do with workforce and resources and utilities and things like that. But I think there's more work to be done with how you will operationalize those plans. Can you go a step further with kind of an accreditation process, or can you ensure that you're planning together with the public health department or with your local hospitals? So I think at this stage, it's still variable and based on those relationships and people's ability to come together beforehand and in anticipation. But there's not a strong standard that we're surveyed to and held to, other than that kind of paper standard.
Thank you. Anand, you're looking at this through the lens of policy, and these emergencies are happening with greater frequency and intensity, whether we're talking about weather-related emergencies like extreme heat or the hurricanes or other issues, but also infectious disease outbreaks, et cetera. How do we make policymakers truly understand the importance of what Susan described, the other 364 days, which are so critical to then how you respond and how you recover from these types of emergencies?
Yeah, thanks, Nadine, for that great question. Congratulations to you and Tifa on excellent blueprint. Great to be with you and Fred and Susan. I think there are a couple of policy issues. The first is the importance of all hazards preparedness. Any public health emergency can now happen any place at any time. Who would have thought that a hurricane could have such a significant inland impact. And I think that matters for local public health in terms of the messaging to the public, in terms of being prepared. I think that matters for the federal response as well. These are multi-state events now. How do you stretch your resources? How do you connect with private sector partners to form those public-private partnerships for the response? I think funding does matter as well, whether Susan, local public health departments, the public health emergency preparedness program, Fred, the hospital preparedness programs. These are really important federal programs that are underinvested and haven't kept up with inflation. We need to make sure that I think, and this is in the blueprint as well, I think we need to make sure that these programs are fully funded. But even beyond that, there are myriad other policy issues, from flood insurance to weather forecasting through AI, through how do you plan for coastal communities, infrastructure resilience. So a lot of this emergency management and public health, I mean, it's all coordinated, it's all connected, and public health has to be right there.
Absolutely. I'm going to stay with you, Anand, in particular to then talk about, as you noted, it's important for the response, but then also thinking about how we create these healthier, more resilient communities to be ready to respond to these types of emergencies and disasters. You spend a lot of time thinking about this. How do we talk to an incoming administration really to prioritize prevention and public health? Because we know the numbers, right? Less than 5% of our annual health spending is on prevention and public health, and yet that's so important to us being able to respond effectively to all of these numerous public health issues.
Yeah, so I think, there's a message to an incoming administration, and I think those of you who have been here in Washington, D.C. and been policymakers here, this is a pretty reactive place. We're a reactive town. There are crises every day, small, large, real, manufactured, but there are crises, and a lot of our attention gets focused on those crises. But public health and prevention demands a totally different mindset. You have to be proactive and not reactive. And so I think it's so important, incumbent upon a new administration to really keep this as a top priority. And that's got to be reflected in strategic plans, in president's budgets, OMB budgets. It's got to be reflected in terms of a set of limited metrics to ensure accountability. And then I think Congress also has a responsibility here in Washington, D.C. Next year is going to be a difficult year, particularly given sort of our fiscal environment. But understanding the opportunities Congress has to support public health emergency preparedness, understand public health, even if it's not with dramatic increases in investments, for our federal agencies, budget authorities, data authorities, hiring flexibilities, passing the Pandemic All Hazards Preparedness Act. So there are, I think, a lot of things that can be done here in Washington, but you really have to have a proactive mindset to embrace prevention and public health. Otherwise, every day just becomes sort of, you're reacting to some crisis.
Absolutely, and it's not only, I think Secretary Sebelius uplifted this, it's not only public health to bring voice to this, it's other sectors. I mean, we're in a broader ecosystem, a broader health ecosystem. Fred, with your work as, and being a healthcare system leader, how can, and we're seeing more of this movement in terms of healthcare leaders really stepping up to say, we need to support and promote and champion public health. This is something you do. How can we get more to really step into this space?
Yeah, it can be difficult because it's not, we've got this artificial distinction between healthcare delivery and public health. And I don't know that the expectations are there, that healthcare delivery systems are essentially, they thrive on sickness. You treat illness and you treat the acute, and that's what the economic model is. And so we've got to be more intentional about pointing those systems towards prevention and public health. And I think that there are ways to do it. It would start with just having an understanding of the system. I bet if you polled hospital CEOs, many of them would not know who the local public health director is in their town. And so starting with making those connections is a good start. Planning together. There are expectations in the Affordable Care Act that we all do a community health needs assessment. Doing that planning with the public health agency, because the issues are common. And so doing that planning together is important. working on things like data reporting, electronic reporting of data, those things you can do together. We've been able to support our local public health get on Epic because oftentimes they're not going to get the attention of those systems, but you can help them to do that. And so I think being intentional about working together, and then from a policy perspective, putting some expectations on the health systems to say, you've got an expectation to do community health needs assessment, do that together. You've got community benefit expectations, invest in the community through these identified needs, and then some of the financing as well. Medicaid waivers, for instance, where you can put some expectations on prevention, screening, those types of, and incentivize those types of behaviors from health systems that don't, again, normally that's not the economic model for big delivery systems, but you can use some of the payment levers to point them in that direction.
So you're pointing in particular to some actual abilities of federal agencies, whether there's movement in terms of Congress, but actually some actions that could be taken as well from federal agency leadership to be able to move these types of incentives, if you will, or requirements forward. Right. So, Susan, I think it would be helpful to hear, certainly from you, there are a lot of comments being made about the capabilities and the partnerships and relationships that public health has. But there are threats, and there are also ways in which public health, as we've been all talking about, has been underfunded for decades. Can you talk to us about, what you're seeing as the threats and what are the opportunities? We want to certainly not pose this solely as the threats that public health is facing, but what are the opportunities, whether they're low-hanging fruit or just actions that can be taken that we can move on quickly at the start of a new administration from your vantage point?
Yeah, thanks for that question. So, I will spend 10 seconds talking about the threats because we all know what they are. Trust, erosion of public health authority, mistrust in government in general, we see those things. And now shifting to the opportunity, which to me is, I think we need to talk about all the ways that the American people have already put their trust in public health. Every time you drop off your child at a child care facility, public health was there, making sure that you could pick up your child at the end of the day, and that child was in the best possible environment. If you have a loved one in long-term care, public health was there, making sure that infection prevention policies were practiced to the best of that facility's abilities. If you are building a house, public health was there checking the soil to make sure that your septic system did not leak sewage into your front yard. We know if you go to a restaurant, the restaurant staff worked hard with public health to make sure that you did not walk away with a GI illness. And if you gave birth, public health was there making sure that your child did not have a rare congenital illness and giving that child the best chance of life. So those are all the things that public health is already doing. Those are all the ways that people have already put their trust in public health. And I think those are the stories that we need to start lifting up and talking more about. And I think doing that not only helps build trust, but also helps us advocate for then those things that we need. And I want to touch on one thing Anand mentioned around the FEP funding. In North Carolina, I was looking at some of our figures. We get about $15 million a year, which we put to really good use. Our counties get a lot of that funding. When you divide that by 100 counties, that's around $150,000 per county per year. And, I think about just the devastation that we are now, of course, seeing and hearing about from just Helene, hundreds of millions of dollars that a single county will face. $150,000 investment, hundreds of millions of dollars that we will now need to pour. And not all of that is preventable, but I think some of that could be if we relook at the equation of what we are investing up front. So, I think those are some of the opportunities as we think about building trust in public health and really helping support investment in public health as well.
Can I just second that? Because I think Susan's point here is probably one of the, maybe the most important of the afternoon, because I think at the end of the day, the currency that public health runs on is trust. And for too many Americans right now, they are equating public health to vaccine mandates or mask mandates or school closures. And they have no idea that public health is ensuring that our air and water are clean and everything Susan said, our roads are safe and our schools and businesses and restaurants are hygienic and we're keeping substances away from harmful substances away from our community, infectious diseases, all of that stuff. That public health is part of our nation's infrastructure, just like the electric grid and telecommunications and roads, bridges, and tunnels. And we have to think of it. So it's a kitchen table issue, right? we need to make public health a kitchen table issue and somewhat relatable. And I think we've heard that from both Secretary Sebelius and Secretary Levitt. But ultimately, it's trust. And so we can talk about investments, we can talk about governance, we can talk about workforce, we can talk about data. Those are all challenges. But the core issue comes down to trust. And I think also building those multi-sector alliances with business, with faith-based communities, with community-based organizations, so critical for us to do the work that we know is important to do. So sorry, I know that wasn't the question, but I just felt
absolutely. It then puts you on the hook for this next question, Anand, which is getting to that point around trust. I mean, there are challenges to the issues of trust, public's trust, but also ensuring that the agencies, federal, state, and local, are able to do their job. You heard that in the overview of the presentation. And so a question here is, with these types of proposals that potentially could restructure agencies or put into question the authorities of agencies, what can we do in terms of our roles as advocates or others to ensure that those types of changes, structural changes and weakenings of authority does not happen, and elevate this as it could be a risk for public health?
Yeah, well, I mean, I think it's important to ensure that any solution matches the problem, right? So, for example, at the federal level, ideas of breaking up agencies because it might help us respond better to an emergency, those don't really always hold water, right? For example, this idea that we should de-link chronic diseases from communicable diseases. Both are inextricably linked. And the threats that we face today are both chronic as well as infectious diseases. And we need to have agencies at the local, state, and federal level that can respond to all of the threats that are there. So one is just, I think, making sure policymakers understand the myriad threats that we face. And then really just helping them understand the evidence base behind how we respond to all of these threats as well, that this isn't sort of big brother or isn't the nanny state. This is based on science, this is based on evidence. And then having allies in other sectors also carry the message as well. So I think that's probably the best way, whether it's threats at the local level, state legislators, or it's threats at the federal level in terms of Congress, making sure that they understand that the solutions sometimes that are putting forth aren't always going to address the problem that they see. Certainly there are things that we can do better. Let's not make things worse.
Yeah, absolutely. I think a key part of what both you and Susan are also articulating is talking about the impacts, right, of public health and how, it is truly making a difference in people's life every day. It's improving health. It's addressing and protecting from threats that we may not even know or be aware of. And some of these investments, when we speak about recent investments, for example, around data, and data was a big topic in our first panel with the secretaries, was the importance of modernizing the data systems. Fred, you're leading Parkland that has been actively engaged in this effort. And this is another bright spot that we can talk about when we say, when you invest in this, there is a return on the investment. And that is, for example, what's been done in electronic case reporting. Can you tell the story for us of what has happened at Parkland in terms of how you've really been able to advance this work, and it's actually helping to improve opportunity and lives, for the people that you're caring for, and the partnership with public health that you have in doing so?
Sure. Well, we have invested heavily in being able to, take the step from the moving to the electronic health record, as Kathleen talked about earlier, and then being able to now, how do you use that information and the myriad of other sources of information that's available out there to understand the health of the population, and to be able to point to where the needs are and how do you address those needs. So things like monitoring the areas of greatest need according to demographics and social needs and other chronic disease indicators, to be able to identify where to invest your education resources or your interventions or your next clinic. So to be able to do that. But then at the level of reporting, what you've mentioned, a number of health systems have now gone to electronic case reporting. So moving from either the paper or from the health record or from the lab reports, but to be able to do that electronically, report that to the CDC, get that information back to the states and the locals, to be able to track in more real time trends, whether it's respiratory viruses or whether it's chronic disease trends that you can intervene on. But it sounds pretty simple, but it involves investing in data systems so you have a common language. Public health has a different language than the hospitals. And so being able to invest in those systems, the time, but then the return it's so much easier now when it's flowing from Epic into the federal and state reporting systems to be able to have reliable, consistent data. It's like I said, it sounds pretty simple, but there's a lot that has to go on behind the scenes to be able to make that transfer happen. And health systems have to invest in that. And public health systems have to be able to invest in that. And they need resources to be able to do that.
Why don't we turn to some audience questions, if we have any audience questions at the moment? We have a question from the virtual audience. Yes.
A member of our virtual audience asks, what are the best ways in which policymakers can support essential public health workers specifically who are instrumental to ensuring all systems continue during crisis, emergencies, and pandemics?
Brandon, could you repeat that question, please?
What are the best ways in which policymakers can support essential health workers specifically who are instrumental to ensuring all systems continue during crisis, emergencies, and pandemics?
Who'd like to take that question?
I'm happy to start off,
Yes.
and then folks feel free to chime in. I think this goes back to also behavioral health, mental health resources that are so important for the population. Certainly for our first responders, also critically important as well, whether that's public health workers on the first line or other public sector workers. So I think one is that. Second is showing our public health workforce that we value the work that they do. And really, at the end of the day, ensuring people understand their value goes back to what are we investing in our workforce? And investing in our critical public health workforce through recruitment efforts, through pipeline programs, through training, through making sure that they are making a salary that is market rate. Those are all things that are important. And I know, we coming out of the pandemic saw a 30% vacancy rate, close to 30% vacancy rate in our public health department from people retiring, people who, spent those several years working incredibly hard and then were ready to move on to something else. And for many that, suffered the impacts of mental health and post-traumatic stress and many other things. But the way that we were able to make an impact on that number and decrease it by 30% over a year was by supporting pipeline efforts. We had partnerships with our HBCUs to allow interns to come in. We were joking that we don't do tours, but actually we did do tours for elementary school students, high school students, graduate students. We started fellowship programs that enabled people to get their experience. We looked at all of our data and identified the types of workers that had the highest vacancy and turnover rate, and then we invested in salary efforts thanks to some funding we got to the legislature. So really, really intentional investment. Oh, and we created a workforce campaign, I think, talking about a lot of those ways that public health supports the community, both to educate people on what public health does, but really to also recruit the next generation of workers in the public health. So I think all those investments are important when we talk about workforce.
Yeah, I'll just add that there's a very important CDC public health infrastructure grant that's playing out around the country right now, and many, many people are being employed because of that. But there's a concern what happens at the end of this grant to that public health workforce. And without the long-term sustainable investments in public health, it's going to be hard to maintain that workforce. As you all know, the best research indicates that we have about a $4.5 billion annual gap in ensuring that our public health departments have the capabilities they need to ensure the conditions that populations can be healthy. It's unclear whether we're going to get that long-term sustainable investment from the federal sector. And so I think thinking about, as Secretary Leavitt said, what are other ways to shore that up? Certainly some states have moved forward. Judy Monroe's here in the first row. States like Indiana have pushed forward their state legislature to increase investments in public health. There are probably red, blue, and purple examples like that, but we need to understand how we're going to get this long-term sustainable investment. But it's probably going to have to come from the federal, state, local, as well as the private sector as well. So the funding is connected in some ways to the workforce, and something that we need to continually think about.
Absolutely. Do we have some more audience questions?
Well, thank you. Octavio Martinez, Executive Director of the Hogg Foundation for Mental Health, as well as a TIFA board member. Great panels. Question, you mentioned collaborations, mentioned different sectors. One of them I haven't heard too much about, and I'd like you to weigh in on, is actually the private sector. So having a healthier America is extremely important to all our employers, large corporations as well as small businesses. How can they, looking forward, do need to participate? How do we bring them into the fold to be part of the solution that is not just on the shoulders of the public health infrastructure and even our healthcare system, but we need them at the table? And I'm just wondering, what thoughts have you had on that?
Any of you?
But
Fred?
Go ahead.
I can start
This is
real
us-
quick, and
this
then
is us being
while
too
Fred
nice
is
Yes.
well, Fred and Susan think about it. So we did some work, Octavia, with the de Beaumont Foundation a number of years ago, and we call it Good Business, Good Health. The idea was that every local public health officer ought to be connected with their local chamber of commerce, and there ought to be connections in every community in this country between local public health and local business, and this idea that the two are absolutely connected, and whether it's what's good for business or bringing more people into a community, a healthier community is good for business, and it's good for, and it's good for health overall. And so I think the broader theme here is public health connecting to the private sector and other partners that are absolutely critical to improving health. And I mean, I think that's a theme today that we're hearing as well. So that's just one example, but I'm sure they have more ideas and thoughts.
Yeah, I'll just build on that and agree with everything Anand said. And I think, I think about specific examples that we've seen in public health. A lot of the opportunity for investment, particularly in prevention, has only been with the partnership of our private partners. I think about public-private partnerships like we've been able to do around supporting social resource needs and connecting people to different needs in our community. And I think about, at the end of the day, for many of our rural communities especially, it goes back to exactly what you said, which is that the health of the entire community and of the economy of that community really depends back on the health of that community. Particularly I think about the overdose epidemic, and where we saw many, many sectors of many partnerships with our businesses across North Carolina, helping to think about how we combat opioid overdose, whether that was providing support services in their community or whether that was providing jobs to people who were in recovery. And so I think absolutely agree, part of the role of public health is to be that convener, and working with our private sector partners is a critical part of that job.
I'll just highlight another effort, and we saw this emerge through the COVID-19 pandemic, was the establishment of this Health Action Alliance. Some of you may be familiar with this, which is bringing business leaders with public health to really address creating healthier communities, a healthier nation, and understanding that their workers having healthy employees is really critical for employers. This alliance we actually have worked with, for example, with regards to COVID-19 vaccine messaging, really educating around the importance of the role that employers can play in actually helping to promote health. And one of the recent initiatives of this alliance has actually been now the establishment of a national commission on climate and workforce health, recognizing that we're dealing with more and more climate threats as well, like extreme heat. And extreme heat is really a detriment and danger for workers. And so understanding how to bring public health and the business community together, CDC Foundation, de Beaumont Foundation, and others are really supporting this effort. So I think, to your point, Octavia, it really is critically important to bring these other sectors together to recognize that we all have a role to play in advancing the public's health. I am seeing that we are at time. I know I am getting the no, you may not continue. As you can see, these are really important issues that we are facing, certainly in public health. Join me, please, in thanking our second panel.